Financial markets have dipped, governments have begun closing borders, and scientists have raised concerns. It's happening all over again. A new variant of coronavirus, now named Omicron, has set alarm bells ringing across the world. Detected first in South Africa on the 24th of November and eventually in several other places like Hong Kong, Germany, Belgium, UK and Italy, this variant has prompted a renewed concern about the pandemic. Is this variant more infectious? Will this variant evade vaccines? Should we be worried, and what do scientists say? We'll break it down for you. The World Health Organization has classified the Omicron variant as a variant of concern, saying it may spread more quickly than other forms of coronavirus. To understand the behavior of any variant and its mutations, scientists have to do extensive testing. Whatever we know right now is mostly based on hypotheses, speculations, or studies of the past behavior of the virus. But what is the global concern around the Omicron variant? Omicron has 50 mutations in total, of which 32 are in its spike protein. Any changes in the spike protein are worrying because that's the part of the virus targeted by vaccines to block the virus from entering the human cell. In comparison, the highly infectious Delta variant has only 2 mutations in its location. As most vaccines work by forming antibodies against the spike protein, so many mutations at the spike protein region may lead to a decreased efficacy of COVID-19 vaccines. WHO has said that as of now, it is not clear if the new variant is more transmissible compared with other variants or whether it causes more severe disease. To reach any conclusion now is difficult, as more testing and studying the virus is needed. But what concerns you and me right now is whether we can get infected with the Omicron variant if we are fully vaccinated. Scientists are researching how effective existing vaccines might be against the new variant. WHO says that there is very little information on that matter. Breakthrough infections have been reported in South Africa among people who received the Johnson & Johnson, Pfizer, BioNTech and Oxford AstraZeneca's vaccines. Moderna and Johnson & Johnson are already working to test its vaccine against the new variant. But the best positioned is AstraZeneca and Covishield because it is already conducting tests in Botswana where it can collect real-world data. A point to note, however, is that no deaths have been recorded as of now. In fact, a South African doctor who was one of the first to suspect this new strain among patients has said that symptoms of the Omicron variant were so far mild and could be treated at home. But how many cases of Omicron have been detected? Since being detected in southern Africa earlier this month, the cases of the new variant have been spotted in more than a dozen countries. Israel, Hong Kong and Belgium were among the countries where Omicron reached early on. A full list of countries where cases have been reported till now includes South Africa, Botswana, Belgium, Hong Kong, Israel, United Kingdom, the Netherlands, Germany, Czech Republic, Austria, Denmark, Australia, Italy, Canada and France. As for India, we don't have any case of the new variant and have adopted a more cautious approach. The global response too has been that of stricter restrictions on testing and tracking. A number of countries, including the United States, have imposed a travel ban on African countries due to the emergence of Omicron. Several other countries are strengthening their travel restrictions against passengers coming from the countries where the new, potentially deadly variant of the virus has been detected. However, the South African doctor who was the first to detect the variant has criticized the decision by some countries to ban flights from South Africa as premature, as there is not enough information on how dangerous Omicron is. As for India, all international passengers have to submit a 14-day travel detail and show a negative RT-PCR test. Countries at risk for India include all European countries including UK, South Africa, Brazil, Bangladesh, Botswana, China, Mauritius, New Zealand, Zimbabwe, Singapore, Hong Kong and Israel. Everyone on this list has to undergo a mandatory COVID test at the airport and a 7-day home quarantine even if it is negative. If they test positive, then they will be sent into immediate isolation and their samples will be sent for genome sequencing. The bottom line is that we don't currently know what the epidemiological impact of Omicron will be. However, that doesn't take away from the fact that we must at all times ensure that we follow social distancing, wear our masks properly, and encourage everyone towards getting vaccinated.